Carers who do not turn up or who have just a few days training, basic care like feeding and washing never delivered. This is the disturbing picture of the care paid for by local councils and delivered by private companies to older people in their own homes. Today the regulator has announced that inspectors will carry out checks without warning on hundreds of care staff as they visit older people around the country. But in tonight's special report, our health and social care correspondent, Victoria MacDonald, hears how carers themselves fear for the falling standards they're able to offer.
Nearly 500,000 older people in the UK receive council-funded care in their own home. It takes place behind closed doors. But those who receive care and those who give it are now speaking out about their concerns. Sheila Ford is 87 and worked as a carer for 25 years. 3 years ago, she started to need care at home herself.
Caring is something inside you which wants to help somebody else in distress who needs help.
But Sheila's own experience of care agencies has been disappointing. She had problems with carers not turning up, leaving her exhausted and in pain.
This business about not turning up is very difficult because, A, you get to about 8:45 and you think, oh boy, nobody's going to come tonight, and so you have to put yourself to bed. But it means I don't wash because I just can't cope, and I'm tired in the evening. I didn't get creams and things like that. I had to have cream to alleviate the pain of chilblains.
Sheila's experiences are not unique. The evidence we've heard suggests the care system is in crisis. Channel 4 News has obtained this new data from the industry regulator, the Care Quality Commission. It reveals that more than a quarter of the agencies who are paid to look after elderly people are failing to meet minimum standards on care and welfare. But what's even more striking is the massive jump in the number of whistleblowers contacting the regulator to raise the alarm. Figures from the CQC show that in recent months they have received hundreds of complaints about the industry. And Public Concern at Work, the whistleblowing charity that helps employees speak up, says that the last 6 months has seen a 60% increase in calls to its helpline about care. And they now receive more calls about this sector than any of the other public services, including the NHS. Kerry is one of those who has spoken out. She works for a large regional agency and has tried several times to raise the alarm about the safety of clients.
Care plans are supposed to be updated on a regular basis. We go into clients' homes and plans haven't been updated for 2 or 3 years. Medication isn't always updated. It's a huge issue.
Indeed, figures we've obtained from the regulator show that 27% of agencies are not meeting standards on the management of medicines. And what happens when care workers do complain? Kerry says they are ignored, or worse.
If you raise issues with the agency, when they take on new carers, your hours are dropped. I don't think the client's protected, and I don't think the carer's protected.
Clients with complex needs, such as dementia, are particularly at risk. Michael Lowe cares for his mother Muriel, aged 83. She has dementia, and he also looks after his sister Susan, who has learning difficulties.
I feel virtually on call 24 hours a day, even though at times I just don't feel well enough to do this.
In fact, Michael is disabled himself and can't provide all the assistance his mother needs. So it is a strain for everyone when Muriel's care workers don't turn up. He often pays for a private carer visiting today to give her extra support.
50 or 60 years you were married, weren't you?
The level of support that Mum actually gets is inadequate.
One of the biggest issues is time. Care workers spending just 30 minutes or less because they're under pressure by their agency to get to the next client.
I had a problem to get her to eat and to drink. Mum's gone for weeks without a shower, simply because in a half an hour it can't be done.
The UK Home Care Association, which represents many of the agencies, told us that it is councils who are demanding carers reduce the time they spend on visits. And they also want to pay less, the association claims, making it harder to deliver a quality service. Joanna Pitts runs a care agency. She doesn't do short visits, and she pays her staff above the minimum wage.
Would you pay £5 an hour for somebody to look after your mother?
It's an approach that has cost her business. This summer, she handed back a council contract as it didn't cover her staff costs.
I wasn't prepared to cut their wages. I didn't think it was fair to them. So that is why I had to hand the council clients back.
And then there is the issue of training new staff.
When I have a new member of staff, they have 6 weeks mandatory training. I don't think it's safe on a worker or a client to be non-trained. And I think the basic training is not enough.
Yet we've been told that many agencies give less than a week's training. Jill, who's asked not to be identified, works for a national company.
In this climate at the moment, you can come in and you can have your 5-day induction. You can be a banker, you can be a labourer, you can be a shopkeeper. Anybody of any profession can walk into our company and say, I'd like a job, and they would say, OK. And you have your 5-day induction, and once that's all done, away you go.
How do they know that you're capable of doing this job after just 5 days induction?
They don't. They don't know.
Tomorrow, the Equality and Human Rights Commission publishes a major investigation into the care of older people. For Jill, this spotlight on the sector cannot come soon enough.
They live within their 4 walls and they see nobody. And you come in and their face lights up, and for that tiny little time that you get in there, they've got some conversation, some tiny bit of humanity, if you like, with them. That's it.
Sheila Ford's complaints were finally listened to. 2 months ago, she transferred to another provider. But though she's happier with her carers, she thinks the sector is still struggling.
As the time comes for them to go, you can feel they've gone, really. And even the nicest of and the best of carers, they have to be at another place doing somebody else's problems. And that's a terrible way to do caring.
Victoria MacDonald with that special report.